With a legacy spanning over 3 decades, Sanket Diagnostics has become a name synonymous with trust, precision, and compassion in the field of reliable diagnostic services in Zambia. Founded in 1992 by Mr. Salim Patel, Sanket quickly earned the trust of patients and healthcare professionals across India. What started as a community-based diagnostic center has today grown into a globally supported diagnostic hub. Sanket Diagnostic Zambia Limited in Lusaka was established in 2012 and began its journey with a simple mission: to make high-quality diagnostic services accessible, reliable, and rooted in care.
Welcome to Sanket Diagnostic Center, the excellence you can trust upon. At Sanket, we provide the facilities to the patient with modern technology and professional team by providing them radiology and laboratory services. At Sanket, your health, your convenience, and your peaceful mind comes first.
Welcome to Sanket. My name is Wadiamando. I'm the receptionist at Sanket. So at Sanket, we attend to NEMA clients, insurance clients. So our system is cloud-based. We have the system, the SUFRAM system. This is the starting point. You go to the phlebotomy where your blood is drawn.
With 30 plus years of combined experience, Sanket has grown into a globally recognized diagnostic network, offering more than 2,000 tests across departments such as hematology, biochemistry, microbiology, histopathology, immunoassays, molecular biology, clinical pathology, serology, and infectious disease testing. From routine blood tests to advanced CT and MRI scans, Sanket Diagnostics offers comprehensive diagnostic services under one roof. By combining accessibility with cutting-edge technology.
So at Sanket Diagnostic Center, our dedicated team for laboratory technologies, radiographers, laboratory scientists, as well as the supportive staff are always here to welcome you with the professionalism and the smile. Once you step into a moment at Sanket Diagnostic Center in our launch area, you experience a comfortable environment which is designed to make your visit easy and comfortable. As we move further in our facility, let me introduce you our phlebotomy area, the neat, clean and safe area where the blood collection is done.
This is our blood collection room. This is basically where we collect blood and all sorts of samples for processing. And we have a cloud-based internet. So when a patient is referred from the reception to the blood collection room, I'll ask for their details and I'll look it up in our system. From there, I'll be able to print barcodes and then stick them on their bottle tops. We have different bottles for different tests. And the other thing is I have to maintain hygiene here and to also make the patient very comfortable with me.
Once we receive the samples, we carefully take the samples. We check the samples from the unique patient's barcode to just make sure with accuracy, tremendously, and confidentially carefully. Each sample has been barcoded with the name and the lab ID numbers. From this area, now the lab technologists will deliver and they will distribute the samples to the various departments.
Equipped with state-of-the-art machinery and the latest medical innovations, offering specialized services such as digital X-ray, mammography, ultrasound, cardiac angio, CT scan, ECG, EEG, and many more advanced investigations available exclusively at Sanket.
When you come in for a CT scan, first of all, the first thing we'll require of you is a request form from your doctor that will indicate the kind of examination that we are going to do and if it is a contrast or a non-contrast procedure. So if it is a contrast procedure, there will be need of you doing creatinine blood tests because we need to know the state of your kidneys and be sure that they're able to excrete out the contrast that we are going to push in. So CT scan gets images in thin slices. We're able to examine the brain, we're able to look at the chest, the abdomen, the pelvis, and depending on what the patient is presenting with, we can either use a contrast procedure or do a non-contrast procedure.
Today I just wanted to take you through what we do in terms of ultrasound. So we're using a machine called the GE, it's a Voluson S6, which allows us to do a number of examinations, including echo. Yeah, echo is a scan or a type of ultrasound that focuses on examining the heart. So it will look at all forms of conditions as long as it's something relating to the heart. So from childbirth, in case the baby has got abnormalities by birth, we're able to examine that. Young adults who develop chest conditions and other complications. For people who are living with diabetes, hypertension, we're able to examine certain changes in the heart. So the machine also has got a 4D probe. This is a 4D probe, so for pregnant mothers, we're able to do 4D screening, and also we're able to do what we call small parts with this probe. Small parts include the breast, the thyroid, the testicles, in case there are certain conditions that are relating to that. This also allows us to do a scan called Doppler, where we try to look at how blood is moving in the body.
This is where we do culture and isolation of different microorganisms. Here at Sanket, we culture different specimens. We receive blood, urine, swabs, and other fluids. So from here, we check for the integrity of a sample. If the sample meets the criteria, we take it to the laminar airflow where we do the culture of samples. This is a laminar airflow. This machine provides sterile environment for the culture of microorganisms. This machine also helps protects the lab personnel from getting infections. We use different types of media in microbiology. So from the laminar airflow after culturing of microorganisms, we take them into the incubator. So the incubator basically provides optimum temperature for the growth of microorganisms. After the incubation period has elapsed, we take the cultured plates from the incubator, and then we check if there is any growth or no growth on the cultured plates. So if there is growth on the cultured plate, that is, we start bacterial identification, and then if there is no growth on the cultured plate, we record in the book as well as in the system. After examining the stained glass slide, which contain bacteria, we go to the next step, which is biochemicals. So we learn different types of biochemicals, which just help us to intensify and have more information about it, the type of bacteria which we are dealing with.
I'll talk about quality management system, which is a set of policies, procedures, which guides us as a lab. As we are doing all the things in the lab, we need to be guided. Under quality management system, we've got internal quality control and external quality control. Under internal quality control, we've got isolated microorganisms that we isolate as a lab. So as you can see on this board, we've got streptococcus, which is there's a positive control and a negative control. So you see from this this ID which was isolated, it was positive control, it passed. Then when we did a negative control, it failed, and the comment that was given by the supervisor, it was a pass. When it comes to external quality control, we're affiliated to Randox, which is a UK-based company. This UK-based company sends samples from UK, which are blind to us, and they are done using the same procedures which are done according to the same procedures for the lab. As you can see, these samples are brought to us after 3 months. The first sample, according to each cycle, we've got sample 4, sample 5, sample 6, sample 7. So on the 27th of January, we received a sample, and this was the comment and this was the grade. So furthermore, I'll go to this chart. We'll look at the daily microbiological routine. We've got different parameters that we receive, as my colleague has earlier said. And this table shows the turnaround time. So this table guides us to when the sample was collected, was done, and needs to be given out, and the person who did the sample.
I will be discussing with you about the mammogram. So a mammogram is a machine that is specifically for the breast tissue. So it is used just specifically to assess the breast, and either for screening purposes or diagnostic purposes. So for screening purposes, if you know, October is the breast cancer month, and in this month they tend to advise women to actually come in and do checkups in order for them to assess and see how their breasts are. So screening purposes is just for the purpose of them just checking and seeing if there's any evidence of anything that is an abnormality in the breast, be it a mass or anything like a lump. And then for diagnostic purposes, it is used in a situation where the patient actually has a history of a lump in the breast, so they have been feeling a lump in the breast. The doctors would tend to advise the patient to come in for a mammogram so that they can actually assess and see either the intensity of the growth or if it is benign or malignant.
I'm going to explain to you what we do in CT department. So CT usually uses X-rays. We've got a machine which is a high-tech machine, a Toshiba Aculion 64, which is able to do a lot of examinations starting from your head up to the toes. So this CT machine, when I start with the brain we are able to do brain plane, brain with contrast, and then we are able to do CT brain angio like this one on the image. So another examination that we do is the CT abdomen angio and abdomen with contrast. So we are able to do CT abdomen, especially for patients, those who want to donate kidneys, kidney donors, and those who want to receive the kidneys. We are also able to do the unique examination, which is a cardiac coronary CT.
We have different kinds of coils that we use for MRI to enable us capture the images. So if somebody is coming in to do a brain MRI, this is the coil that the patient is going to be placed in. You'll be positioned facing up, and it is very important that even as you are positioned and the examination is going on, you try your best not to move, because any slight movements causes blurring, which is called motion artifacts, and it can cause the images to blur, which can affect the quality of the images and can eventually affect the quality of the report that will be coming out. And then for those that are coming in to do the whole spine, let's say the thoracic spine and the lumbar spine, depending on the size of the patient, we have got different sizes to ensure that every patient that is coming in at least will be fitted in as they are going for the MRI. So we can either use this coil or this one here for the thoracic or the lumbar spine or the pelvic scan for those that are coming in to do a pelvic MRI. So it may be a bit uncomfortable putting it in, but once it is put, you are positioned, the machine goes all the way inside, and then it is centered on the middle, depending on which part is being examined. And then the results takes 2 to approximately 4 hours, depending on the examination that they're doing and the severity of the condition that the patient is experiencing.
Our histopathology department plays a key role in disease diagnosis as we analyze, process, and look at tissues and cells on a cellular level through a microscope. We deal with a variety of specimens of different types so that we can rule out cancers, we can rule out infections, and we can also rule out inflammation. Our state-of-the-art equipment allows us to give accurate and timely diagnosis to our patients, as we believe early diagnosis will aid in the prognosis and the disease pattern of our patients. For example, we have this Pan-C2 vacuum tissue processor. This tissue processor allows us to process about 500 samples at a go in a vacuum processor, hereby minimizing our exposure to fumes. We not only look at the quality of life for our patients, but also the quality of life for the people working on the team. We try to minimize our exposure to toxic fumes. We also have state-of-the-art technology known as immunohistochemistry, commonly known as IHC. IHC allows us to look at proteins that are attached on the cells. For example, proteins that are found in breast cancer or breast cancer, such as ER, PR, and Ki67. These proteins are important as they are able to help us give the subtype of the cancers, give us the prognosis of the cancer, and also identify or rule out the spread of the cancers. We also have cytology. Cytology is the study of cells in fluid samples. For example, fluid samples such as the pap smear sample, bronchial washings, or CSF. We can look at the cells that are in those specimens and give a diagnosis based on that. It's important for us to do cytology. Cytology is a cost-effective and potential early diagnostic marker for various diseases and conditions.
In our hematology department, we conduct various type of tests just like full blood count, anemia profile, such type of vital test, clotting profile, the vital test which can help to ensure the health status of the patient. With modern technology and internal quality control, our hematology team ensures the accurate results should be delivered on time to the patient. In our hematology department, we are going to monitor for the diabetic patient, the diabetic monitoring panel on this machine by giving them HbA1c 3 months glucose average test. And on this machine, we can give the patient their thalassemia status, whether they are thalassemia minor or major. Nowadays, it is very common for every patient to know their genetical status for thalassemia.
Basically here, we have got a biochemistry machine, which you can load up to 40 samples. In that 40 samples, you can put up all the parameters for biochemistry, where you can do kidney function test, liver function test, lipid profile, uric acid, everything you can do in here. So it's a fully automated machine. So another one, we've got this one also, which is also a fully automated machine, just like this one. It's a big one. This one, you can load up to 93 samples on this one. So next one, we've got this one also for ABG, blood gas analysis, where you can have all the parameters done on this one. The next one, we've got for electrolytes. This is under also biochemistry, where you can do sodium, potassium, ionized calcium, and everything under just 1 minute.
In this our molecular department, we use the nucleic acid amplification techniques or PCR method to detect the disease at the genetic level sometime before the symptom appears. So this department plays a key role in detecting viral infection, genetic markers, and other conditions with unmatched accuracy and sensitivity.
Our X-ray machine is a DR system. What this entails is that it has an imaging plate that enables us to capture the images. So we don't necessarily need to take this imaging plate for processing. Every time the patient comes, depending on which part that we're examining, all the patient needs to do is be positioned. If we're doing an extremity, for example, the knee joint, the knee is going to be placed here, and then we're going to collimate and focus on the area of interest. So where the light is, if the body part is here like this, if we're doing the hand, for example, and then we collimate to just focus on this means that radiation exposure is just being placed just on the hand where the light is going to be. For couples that have been struggling with fertility issues and they are trying to conceive but they are not able to conceive, in as much as there are different factors that may cause the couple not to conceive, oftentimes blocked tubes tends to be one of the predominant factors. So the doctor would request that the patient does an HSG. So for those examinations, we use the X-ray machine to acquire that. This is called a vertical bucky that enables us to capture the images for the chest, even the skull. We also get images for the cervical spine, the shoulder, the humerus as well. So if one is doing the chest X-ray, for example, the patient is going to be positioned facing this way, their chin is going to be placed here, the hands are going to be on the hips, they'll be made to separate their legs, and the shoulders will lean in. The patient will then be asked to take in a deep breath and hold their breath, and then after that the image is going to be captured. If you are doing the skull, depending on the height of the patient, we tend to elevate this, and then the patient is going to be positioned in a particular way. So depending on which part, we have different projections that enable us get adequate images that are going to help the doctor assess what the problem is with the patient.
In immunology departments, we make sure to we play a vital role for the clinicians so they can make the final decision for their patients. So in our immunology department, we perform a wide range of immunological investigation. which are essential to diagnosing infections, hormonal disorders, and allergies, and many more other clinical conditions just like cancer. Immunology department is powered by our highly sensitive and accurate machines Maglumi. So these machines are going to provide the highly accurate and sensitive results very accurately and in a very short time.
With 7 centers now operating across Zambia, Sanket has brought world-class diagnostic excellence closer to communities, reducing travel distances, cutting report waiting times, and making international quality diagnostics available right here in Zambia.
Sanket is also involved in the external quality control, collaborating with Randox UK. So they are sending us the unknown samples and we are going to perform them. We send the results to them, then they verify and they send the results to us. And for the external quality control, we just use the control which comes with our reagent. So Sanket is going to maintain the external and internal quality controls both, but external quality control just with recast.
Supported by a dedicated team of over 200 skilled medical professionals and employees, Sanket Diagnostic continues to deliver precision, care, and trust in every test.
We have a good group of pathologists. Our pathologists are strongly trained, and also we have a neuropathologist on hand.
Today, Sanket stands tall as one of Zambia's most trusted diagnostic network, proudly partnered with both public and private insurance companies nationwide. With 9 centers and growing, Sanket continues to expand its reach, ensuring that quality diagnostics are accessible to every corner of the country. Having served over 6 million patients globally in the past 5 years, Sanket's story is not just about numbers. It's about accuracy, empathy, and excellence in every step of healthcare. Because at Sanket, every test matters and every life counts.